Thank you. I want to start by both congratulating and welcoming my constituents, Meredith, Mira, Sylvia, and Talon. Welcome to our nation's capital, and I want to thank you for your role in the JDRF 2023 Children's Congress and for your continued advocacy on behalf of Wisconsinites with diabetes. Your advocacy really helps drive the work of Congress, and I want to thank you for using your voices for this important cause. This is for Dr. Rogers. The Max McGee Diabetes Research Center in Milwaukee, Wisconsin is focused on early identification and prevention of type 1 diabetes. Thanks to funding from the National Institute of Diabetes and Digestive and Kidney Diseases, the center developed a novel and I think cutting-edge blood test that can detect inflammation associated with type 1 diabetes up to 7 years before the disease's onset. This test is already helping researchers better understand how patients are responding to new therapeutic interventions and strengthens our understanding of the development of type 1 diabetes. So, Dr. Rogers, can you describe how research that focuses on the development of type 1 diabetes leads to progress in preventing juvenile diabetes?
Yes, thank you, Senator. That's outstanding work that's being done by investigators in your state. You know, I have to say the Special Diabetes Program, as I mentioned in my introduction, over the years of this continuous funding has really changed the way we think about diabetes in the various stages. It's not that you have it or you don't. We know that it progresses through several stages until one actually develops clinical disease associated with abnormal blood sugar levels. And it's getting the disease in people who are extremely high risk after they have antibodies, but before their blood sugar gets out of whack, is critically important because that leads to the development of studies such as was reported by Senator Collins and has been mentioned, this drug teplizumab, for example, which works in the immune system to actually stop the immune system from damaging those insulin-producing cells. So having ways of defining the disease much earlier is critically important for prevention. And we continue to work with investigators throughout the country to try to come up with a more precise, easy, and a more accurate way of detecting that just for that purpose.
Great. Thank you. Also, Dr. Rogers, thanks to the Special Diabetes Program, people with type 1 diabetes are living longer than ever, but there's much more that we can do to improve the lives of those with type 1 and make sure that we're working to reduce complications. This is especially important for children living with type 1 diabetes, including the Wisconsinites who I welcomed earlier. Dr. Rogers, what are some of the understudied complications of type 1 diabetes that you hope will be examined in the future, and how, what are the gaps or things that we haven't studied enough, and how will this research improve the lives of many in this audience?
Two aspects to that. I'll answer your question in two ways. Number one is there are understudied groups of individuals with type 1 diabetes that unfortunately industry isn't studying that much, and this is where SDP fills in a gap. Those understudied individuals include those who are pregnant, those who have frequent episodes of low blood glucose, or this condition that Dr. Kowalski mentioned of impaired hypoglycemia when their blood sugar dips very low. Older adults and very young adults are understudied. Those with lower in education levels are also tend to be understudied by industry. Now, with respect to complications of the disease, something that we really need to focus on, because this is where a lot of the funding for diabetes comes in people with heart disease. And unfortunately, it looks like people that have type 1 diabetes may have a different form of heart disease in terms of its manifestations. Diabetic foot ulcers is something that I think is very much understudied. We've begun a consortium to study foot ulcers because once people get this, you may not be aware, but the mortality associated with having foot ulcers actually is very close to some people with certain types of cancers. And so those are two areas. We've learned a lot in terms of diabetic eye disease and other manifestations. But if I had to pick two complications, that would be where we want to focus. And we have studies already developed in that regard.
Thank you, Dr. Rogers.
Thank you.
Thank you. Senator Hyde Smith.